Hey everyone, Dr. John Stevenson here. What I'm going to do is show you how to use the 2407 Rebuilder today. We prescribe this one when we're having patients that have neuropathy or symptoms, numbness, tingling into both their hands and their feet. This is really designed to maximize your results, but also maximize your time as well, so you're not doing treatment all day, every day. So with the 2407, it will come in this kit here. When you open it up, you can go ahead and take out the 2407. You can go ahead and just set the case to the side. Now when we're using the 2407, it does come with a 9-volt battery, which you can use that if you're traveling a lot. Ideally, what we would like to use, let me go ahead and just get this out of here. It is a very snug fit. That's good, so then we don't have any conductivity issues. So what I'm going to do today is unplug the battery because we're going to use the power outlet. This helps improve the strength of the unit when you're using it to help maximize the results. So I'm just going to set the battery off to the side here. And then the adapter will come just in this little box here. So I'll open it up. Set the box to the side, take it out of the bag here. What this will do is just plug right into the side of the unit. So if you look here, I'll just go right into the side, just like so. Okay. Then what you'll do is you'll plug it into, of course, get the twist tie off. You plug it into an outlet. Of course, make sure the outlet doesn't get close to the water or anything like that. So once I have this all set up, I'll make sure that the foot bath is filled right up to the ridge. So you should be able to see that ridge right here, just like that. And I'll just set it on the ground right in front of me. You'll take your conductivity solution here, 4 squirts on each side. If you read the instructions, it does say 1 tablespoon. 4 squirts will be enough to help with that conductivity. I'll just twirl it around with my finger on each side just to make sure that solution is fully dissolved. Of course, what you'll do is you'll take off your socks, your shoes, roll up your pant legs, and you put both of the feet into the water here. Okay? I'm not going to do that today, but I'm going to show you how to use it overall. Once that's set up, I will do the same thing for the hands. So you should have got these hand baths here. You'll make sure that any jewelry that you have on, rings, watches, things like that, you'll make sure that you take off during this. Typically, we'll do this right at the kitchen counter. So then what you'll do is you'll have the hand baths ready to go right on the kitchen table. Okay? So same thing, you fill them up with water. You put about 2 squirts on each side of the conductivity solution. Once they're filled with water, twirl them around a little bit so then they're ready to go. I'm just going to set those to the side right now since I don't have a counter in front of me. You'll get your lead wires. So I'll just unravel those. You'll make sure that the rubber paddles are attached. You do not want to use the sticky pads on this one because we're putting them in the water. The rubber ones will work way better. So 1 on each side, then I'll plug it into output 1. You always want to make sure that it's a very snug fit, that it's all the way up against there. If it's not all the way up against there, that's where you'll see that current cut out. So I'll get that one hooked up. I'll put the other 2 into the hand baths, but first I like to get the foot started. So with my feet, let's say both my feet didn't have my shoes or my socks on there or anything like that, I'll slowly turn that up. Okay, we want to make sure that it's at the 7.83 hertz. That way it's really communicating with those nerves. Now it should never be uncomfortable. What we typically tell you to do is start at 3 and then work your way up from there. Okay. Of course, if it's ever uncomfortable, you're too high, sometimes you'll feel a good stimulus, good muscle contractions. So after a couple weeks, you can start to turn that up until you start to feel it a little bit more. Either way, that current is connecting to each other, the two electrodes, getting those nerves communicating properly again. Once that's all set up, I'll let that go. I'll get my hand baths, I'll set them up top, and we'll do the same thing. So one on each side, one in the hand baths. Plug that in. Make sure it's nice and snug. And then on output 2, I'll turn that up to 3, put it in the hand baths, and then I'll put my hands in there right afterwards, okay? It's okay if the electrodes touch your hands, it's okay if they don't. As long as that conductivity spray is in there, you'll get the currents traveling through those areas, retraining those nerves, okay? After you're all done, of course, the lights will turn off after 30 minutes. We're typically starting patients off at 30 minutes in the morning, 30 minutes at night. That way we're really getting that repetition in there to build up that momentum back in the right direction. Now, once you're all done, what I do is I always make sure that they're turned off anyways, even though the timer goes off and the machine looks like it's turned off. Go ahead and make sure that's turned off. I'll unplug the unit from the wall. And I'll just clean up my station here. So I'll make sure everything's put back away. If you want to, especially in the beginning when we're doing this more routinely, a lot of my patients like to leave it out just so it's really easy to get started again. So they'll just drain the water and then refill the water back up when they're using it again at night. Now, of course, if you have any questions, just go ahead and send us a text message, or you can message us on the BodySight app, or you can give us a call during normal business hours so we can go over any more of this in detail if need be. I hope you guys are having a great day, and we'll talk soon. Bye.